The biggest advantage that we've seen is it brings us information to us. We don't have to search for it. It alerts my team, both inpatient and outpatient, of PE patients that I don't have to search for, which is a huge time saving for me, for my administrative staff, and the PE team. And we can make a lot of decisions more quickly that way. It's a tremendous savings in time and effort that we can better put towards patient care than we used to do. I do remember a patient who was very tenuous in the ICU, and it was must have been 11 o'clock, 12 o'clock at night, and I was out of town, actually. I could see everything I needed to see from a remote location and then provide the team with information when I really didn't have access to the computer or system where I was. So if I had not had that information, that patient couldn't have been treated as effectively and successfully as we did. My hospital system here is about 6 or 7 hospitals, and I am the one who runs the PE clinic outpatient. So what happens is now I don't have to depend on anybody out there to bring me or bring the awareness of a PE patient to me as I would have had to in the past. And so my administrative staff is able to, through the app, be aware of all of these patients throughout our system, and they can bring them into the PE clinic. So clinically, that is an unbelievable savings of, again, cost, time, inefficiency, to help make sure that the PE patients are seen in a timely fashion, and also in an effort to find out who are going to be those patients susceptible to chronic thromboembolic disease. And the more we have that surveillance, the easier it is to tell who those folks are and intervene for them before it gets to be an irreversible problem. If you get a call at 2 in the morning and you've got to get your wits together and get out of bed and get on the computer and then start texting people, etc., and whereas the app brings it all to you right there, and you have a conversation right there. That's a huge efficiency. You get back to sleep earlier, the patient gets taken care of faster. You're not as worn out for the next day. You could probably accomplish the same thing as we could have in the past in about half the time. If you aren't grasping the importance of that and integrating it into your care flow, then I think you're going to be missing something. It's exciting to be at the front edge of technology in medicine. It's fun to be that champion.